Caring for your teeth from age 1 to 100. If you take care of your teeth every day, they'll take care of you for a lifetime. Here's a little secret: it's possible to live 100 years and still have your natural teeth. Even if you grind them when you're stressed out, eat a lot of sugary foods, drink too much coffee, which can stain, or occasionally forget to brush and floss, you can still have healthy teeth for many years to come. If, starting in the teen years, you develop good brushing and flossing habits, you are less likely to have dental problems as you age, says Martha Cortez, DDS, who practices in Manhattan. People with healthy teeth will actually reduce their risk of diabetes and cardiovascular disease, and have lower blood pressure, if they follow what we ask them to do. I have some older people, says Dr. Cortez, who have actually started crying, saying, "If only someone had really made me understand this. If only I had really understood how important a simple thing like brushing and flossing is, and what a difference it would have made." Good dental care starts in infancy, before teeth even appear, and requires daily attention throughout your lifetime. Here is an easy guide to help you keep your teeth and your smile as healthy as possible. Childhood. All children should be seen by a dentist by their first birthday, according to the American Academy of Pediatric Dentistry. The dentist will instruct you on how to keep your baby's mouth clean and tell you how to avoid problems such as baby bottle tooth decay. There should be no bottles or sippy cups with milk or juice in bed, says Beverly A. Largent, DMD, president of the AAPD. When children go to bed, they do not swallow as often. The teeth are then constantly bathed in a sugary substance. Decay can be so rapid that people think their baby's teeth came in that way. Even before an infant has teeth, you should wipe his or her mouth daily with a washcloth or specially formulated dental wipes to help eliminate bacteria that can cause thrush, an oral yeast infection marked by irritation and white patches in the mouth. Move on to a soft toothbrush once teeth erupt, brushing at least once a day, says Dr. Largent. As a rule, children cannot be expected to brush their own teeth properly until they have developed the fine motor control that allows them to write in cursive, around age 8. Flossing should start as soon as a child's teeth are touching, usually by age 3. Schedule dental visits twice a year, and ask your dentist about dental sealants, which can protect teeth against decay. If you use well water, be sure to ask whether fluoride supplements are necessary, advises Dr. Largent. Adolescence. As children enter adolescence, their new set of adult teeth is at an increased risk for cavities and gum disease. That's because brushing and flossing has now become their own responsibility and they might not be so vigilant about it. While away from home, they may consume large amounts of sugary beverages that feed destructive oral bacteria. We tend to see a lot of decay between the teeth of patients at that age, says Kimberly Harms, DDS, consumer advisor for the American Dental Association. They know how to brush, she says, but flossing to get rid of bacteria between the teeth becomes just as important for healthy teeth. Wisdom teeth also become an issue in the teen years. They should be removed, Dr. Harms says, because most people simply don't have enough room in their mouths to accommodate them. The advantage of getting them extracted early, she says, is that they are fairly easy to remove because the roots are not formed and your bone is more pliable. Young adulthood. Young adults often believe that if their teeth aren't bothering them, they don't need to see a dentist. Nothing could be further from the truth, Dr. Harms says. You may not know you have a cavity until you need a root canal, she says, because the tooth doesn't start to hurt until the nerve has been damaged. Adults should brush twice daily with fluoridated toothpaste and floss once a day. Electric or sonic toothbrushes work well, but not everyone needs them, says Jean Connor, a registered dental hygienist and president of the American Dental Hygienists Association. You can clean just as well with a manual toothbrush as you can with a mechanical toothbrush, she says, but most patients have a tendency to brush longer with an electric toothbrush. Dental care is extremely important for pregnant women because studies have shown a link between gum disease and low birth weight babies. Because of the hormonal changes that take place in your body during pregnancy, you are at a much higher risk of developing some gingivitis, Dr. Harms says. The frequency of dental visits depends on your dental history, hygiene skills, and genetics. Most people should have a checkup every 6 months. Midlife. This is the time when your teeth really start showing their age. Fillings you received decades ago start to break down. We start to see more root canals and tend to see more crowns because these teeth have been filled to capacity because of repeated cavities and fillings, Dr. Harms says. Gum disease becomes a formidable foe in middle age, says Dr. Harms. You need to focus on daily flossing and brushing to keep your gums as healthy as possible. Gum disease has been linked with a risk of heart disease, according to the American Academy of Periodontology. Oral cancer becomes a concern as well, especially among smokers. If you have a sore in your mouth that does not go away within 2 weeks, it needs to be looked at by your dentist, Dr. Harms says. Senior years. As we age, medications can lengthen our lifespan and improve our quality of life. Unfortunately, a common side effect of many drugs is dry mouth. Saliva is a natural tooth protector, so having less of it increases the risk of cavities. Many people use candies or gum to combat dry mouth, but such a habit can actually add fuel to the fire, says Connor. Sugar feeds bacteria in your mouth. To stimulate saliva, dentists prefer gum with the natural sugar substitute xylitol, because it mimics the action of fluoride. Sugarless candies and gum are also recommended. If a condition such as arthritis or declining vision is making it difficult for you to brush, try an electric toothbrush. Continue to see a dentist twice a year. By taking care of your teeth, you're not just ensuring a pretty smile. Tooth loss can affect your self-esteem and make it hard to enjoy the foods you love. And if you aren't eating properly, you're putting yourself at risk for nutritional deficiencies. In addition, says Dr. Cortez, poor dental hygiene can cause bacteria to enter the bloodstream, which puts you at a higher risk for heart disease, lung infections, diabetes, and osteoporosis. For these reasons, being proactive about your dental care is worth the effort. It takes brushing twice a day, flossing daily, and visiting a dentist on a regular basis, Dr. Harms says. The rewards are worth it. Good oral hygiene can help you keep your teeth for a lifetime.